Riaz. Today we are going to talk to Dr. Omar Idrees Mufti. He's the head of cardiology here at Maroof International Hospital. A very, very important topic that we're going to talk about today. We're going to, unravel some of the information and misinformation regarding our heart health, how to look after our heart issues and be more on the preventive side. So let's go and talk to Dr. Omar. Assalamu alaikum, Dr. Omar.
Wa alaikum assalam, thank you.
Thank you for giving us a time today. Where are we?
Right now we're currently standing in the Cardiac Catheterization Lab, or the angiography suite of Maroof International Hospital at our Cardiovascular Centre. So this right here is our state-of-the-art cath lab. It's the newest cath lab in all of Islamabad, where we do all of our angiography procedures, angioplasty, stenting, and so forth.
Right, and this is mainly for diagnosis and treatment as well?
Correct. Diagnosis and treatment. So if we diagnose a blockage, we can go ahead and fix it at that same time.
Right, and typically how many patients will you see a day? Is it something that's happening regularly a lot, or?
So we are one of the few hospitals that runs a 24/7 primary PCI service. So meaning that if you come in with an actual acute heart attack, at any hour during the day, our cath lab is open, and we will bring you up and immediately open up that vessel within 90 minutes of your presentation to the hospital.
Okay.
So one of, I think, 3 of the hospitals in town who actually do that.
So these emergency services
are available 24/7.
Right. Okay, so that's really informative. We have to talk about this more in depth, so let's join you at your office.
All right, thank you.
Dr. Omar, thank you very much for giving us the time to sit down today and talk about this very important issue.
Thank you. I really appreciate this opportunity to discuss this very, very important health concern across the nation and even the world.
That's absolutely true. Now, what we're going to talk about today is so many people, have access to information when it comes to heart issues, heart disease, and other things as well. The main thing is sifting through that information and getting people to understand how they can be more vigilant, number one, and also employ preventive measures when it talks about issues relating to heart health. How can we sift through that information, first of all, for the general public, and then for those people who are at risk and who have high risk factors?
Well, a very good question. Now, the issue these days is you have an overload of knowledge. You can go online and Dr. Google will tell you this and that about whatever condition you put in the search engine. Now, the issue is sifting through that knowledge and coming up with what is correct. Now, there's certain websites that can help you deal with that. There's Medscape, you can go to Mayo Clinic, Cleveland Clinic. But probably the best person to go to if you're concerned with your symptoms is go see your primary care physician. Discuss your symptoms with them. They have the knowledge, the requisite knowledge, they know where to go, what to do, and then can direct you on the right path. So if you go to your primary care physician because you're having headaches and vision changes, they can examine you, see if they need to send you to an optometrist or an ophthalmologist, versus if this is your blood pressure that's causing the issue, and that if you need to go towards a cardiologist, or if it's something that they can handle themselves.
So the best thing to do if you have a particular health concern is not try to address the issue yourself, but go to your physician and then get them to actually understand who you need to see.
Correct. Trying to address the issue yourself, you're just going to cause yourself more anxiety, more concern. Because when you put it into the internet or in Google, it's going to come up with a ton of different information that you're just not going to be able to comprehend.
And very scary situations.
Very scary situations. I have people who come in with multitude of issues saying that Google says this, Google says that. The other issue that we have in our society here in Pakistan is everyone has a relative who is a physician. and they will go and ask that physician as well, be it if the physician, if their issue is something to do with their child, they'll go and ask their gynecologist something about it, or a surgeon, when you should be asking the actual specialist regarding that certain point.
That is such an important point that you have raised there, in fact, because due to the high number of doctors we have in Pakistan, as you rightly pointed out, so many people will have a cousin, an uncle, somebody else who's in the family, and they'll be sort of handing out haphazard information. So it's so important to have your reports, everything in order, and go to see a doctor properly who will sit down and understand your case, not something, a conversation you're having at the dinner table.
Correct. So the way I like to envision and the way I like to tell patients, at least the way I told them in America when I was there, was that we want someone to be the quarterback of your team. So if you take it from the Pakistani perspective, we want someone to be your cricket captain. So they're the one who's managing, who's going to be the wicket keeper, who's going to be your bowler, who's going to be your batsman, and so forth. And that should be your primary care physician. And they can then direct you, if you need to go to a specialist, to, let's say, that wicket keeper over there, they'll be the bowler, they'll be the batsman. So you need someone to manage the team. And it's better if it's someone who's distanced from you from a personal perspective, so not really a relative.
That's a fantastic analogy that you just gave us. I mean, so many people will be able to understand that now you put it in terms of cricket. So, as in other areas of the medical field, you can have sort of like 6-month screening or maybe a year where you go to see your physician. Does that happen with cardiology, or is it usually people who come to you when the symptoms are bad and you wish they had come earlier?
Well, we see a lot of that. We see a lot of patients coming in when the symptoms have actually gotten to the point where they come in with an acute event, like an acute heart attack. And at that point, it's an emergency situation, and you have to take them in to the cath lab and perform whatever procedures necessary with angiography, angioplasty, and so forth. The best option and the best thing to do is we would aim more towards prevention. So just like you're supposed to go see your family doctor every year or every 6 months, or you go and see your gynecologist every so often when you're pregnant, you should go see your family physician, or if you're concerned or they're concerned, they can refer you to a cardiologist, but it should be beforehand. And from the cardiac perspective, we like to see people, obviously, people who are at risk as well. So we see patients who have high blood pressure, who have kidney issues, particularly patients that have chronic kidney disease or on dialysis or heading towards dialysis. Diabetics are very key because they are the equivalent of heart disease. Anyone who has diabetes, we consider them the equivalent of heart disease. And if you have a family history of heart disease, so if you have a first-degree relative who has heart disease, so that be it your mother, your father, your brothers, your sisters, if one of those individuals has heart disease, you're at higher risk, and you should get screened as well. And then the screening that we usually do entails, we first and foremost get your history. We want to hear from you what your symptoms are, what your activity level is, what your risk factors are. Are you a smoker? Are you a diabetic? Are you following an appropriate diet? Are you exercising like you should? And then from there we go down the line and get the investigations that are needed. Be it an ECG, an echocardiogram, an exercise stress test, certain labs, particularly like a lipid profile to check your cholesterol, make sure that's in control and optimally controlled.
Very informative, all the points that you have given us. People who are concerned about their heart health and cardiac issues, what is the best diet for them? Because you hear so much going on, in one research you'll hear that eggs are good for you, and then you'll hear that eggs are bad for you, and then you'll hear that, eat as many as you want, it doesn't matter. What would you recommend as a cardiologist? What should be, for not just a person who's at high risk, but to maintain a healthy diet?
Well, very good question. Now, there are tons of diets out there. There have been the fad diets such as Atkins diet, the keto diet, and so forth. But the best diet from the cardiac perspective, generally speaking, is the Mediterranean diet. Okay. So the Mediterranean diet is more so fruits and vegetables, use of your lentils or your dal for
olives,
feta cheese,
cheese,
olive oil would be used as well, more so, and then your white meats, so your chicken and your fish, and that should be baked or grilled, not necessarily fried. So not saying go get your chicken from Kentucky Fried Chicken, but bake it at home, and then avoid the red meats as well. That's the ones that are higher in fats and higher in cholesterol. So that would be one of the better diets. The other one that's actually gaining more popularity is intermittent fasting as well. Intermittent fasting actually has a lot of health benefits. So that's also very good as well if you go down that road. Intermittent
fasting, when we talk about that, there will be a different sort of a schedule for different people.
Yes. So with intermittent fasting, usually the way it is like you can eat whatever you want within an 8 or 9 hour span, and then for the other, be it 16 hours or 15 hours, you can have water and so forth, but no real intake from other standpoints, so no real food. So that actually helps the body's metabolism a little bit better.
Can diabetics benefit from that? Or what about low blood sugar and things like that?
That is one of the concerns that is there, because then you're going to be on insulin and so forth. But generally speaking, then when diabetics when Ramadan comes around and then they are fasting as well, there's certain things that they can do. So if you're on insulin, we obviously hold your insulin. Certain medications can still be given if you're a diabetic. So it can still be used by diabetics, but should be under the care of not only a cardiologist, but your endocrinologist at that point. So if you're planning on going on some sort of diet, it's best to discuss it first with your physician. And if you're diabetic, best concerned to discuss it with your endocrinologist or diabetic specialist.
So that you are, on top of your health management and not the other way around. Your health sort of taking you all over the place. You should be the one controlling what's going on. I think that would be the right attitude.
100%.
And, as we talked about these diets, keto, you mentioned that one, that's gaining a lot of popularity. It's supposed to be, I think, when you have more of the fats.
You have more of the fats.
So as a cardiologist, what would you say about that?
So I've had a lot of people who've been on the keto diet, and they come in, and what happens is it drives up their cholesterol levels. So it drives up your LDL and your triglycerides, which are the precursors to atherosclerosis or plaque deposition within any artery in the body. More commonly, you see it in arteries in the heart, arteries that lead up to the brain, like your carotid artery and so forth. So it's not the most healthy cardiac diet, so to speak. I mean, it helps you lose weight. People do lose weight on it quite a bit.
But at what expense?
But at what expense?
You've got to be mindful of things. And speaking about being mindful, our diets, our typical diets, they consist of a lot of oil and, like the nihari and whatever, and pie and things like that, really rich in fat, rich in oil, rich in all those things, spices as well. How do we develop a cultural shift for people? I mean, for many people, if you suggest to them a Mediterranean diet, they'll say, what? How can it be a sort of a doable balance between the two?
Well, that's a very good question. So the doable balance is what you're aiming for. So in the morning, I would say you can still have your egg in the morning if you wish. Try and do it more so egg whites. You can still have your egg yolk every once in a while. But then instead of having your typical paratha with your egg, go ahead and have brown bread. Brown bread may be better. So you can still mix and match. And then we're still allowed to have our chapatis and everything else. And everything in moderation is always okay. So it's not like, oh, we've made nahari today, tomorrow we're going to make biryani, the next day we're going to make whatever, chapli kebab at home and so forth. You have to do it in such a way that you can have each and everything that you want, but just not maybe every week, maybe every other week, every third week. You can have little small portions of that. And you can still maintain what you want to eat, and it leads towards a more healthier diet overall. And another thing that is going to be key with Ramadan coming around within the next month or so is that what we commonly see is that people in their households, they tend to use the same oil for when they're cooking their pakore or samosa at the time of iftar. And that is just drained in fat. If you reuse it again, they put it on the side, and they reuse it again the following
Very
day.
commonly done in our part
It's
of the
very
world.
commonly done. And I understand from financial aspect, yes, you can't use they don't want to use new oil, but that is drenched in in fat, and that leads to more increase in your LDL, more increase in your cholesterol, and so forth, and will lead more towards heart disease long term.
Right. So basically, as you said, moderation, substituting different things as
Correct.
well, and being mindful for actually what we are putting inside of us, that we have to be accountable for it.
Yes.
So, you know, just like other things as well, we have to respect our bodies.
You have to respect your body, so you have to be mindful of what you're putting in, and then you also need to be understanding that you need to perform daily exercise as well. And by that I don't mean going to a gym, getting a gym membership and going and exercising, lifting weights. Simple things such as walking. Main goal is to have a brisk walk of about 30 to 40 minutes a day. By brisk walk I mean enough that you have a little bit of sweat when you're walking.
And you're a bit out of breath.
And you're a bit out of breath. Now don't push it towards the point where you're having symptoms, because if you haven't done it before and you're going on a walk, it's not like a marathon. I don't want you to go ahead and start running and doing all that. Slow and steady wins the race, as they always say.
Yeah.
So start off slow and gradually get yourself up to the point where you're walking at least 30 to 40 minutes a day. So start off at 5 minutes, 10 minutes the next week, then 15 minutes, and slowly get yourself in it. Because exercise is key. Because one of the things that you do is you take in a lot of calories, but you have to burn those excess calories as well. And that is via walking, and then you limit by limiting the amount of calories you take in. So let's say all of us typically have 3 meals a day. Pakistan, it's usually 4. At times they have, with their afternoon tea, they tend to have a little bit
Constant eating.
Something.
I don't think we even have three or four.
So if you cut out 500 calories in a day, that is 3,500 calories a week. 3,500 calories translates to 1 pound. So if you're cutting out that 500 calories per day, you increase your activity level, you could essentially drop 1 pound a week. So those type of things are necessary in order to lead a healthy lifestyle.
That's very motivating. These are simple lifestyle changes.
Simple things are key. So don't go for the fad diets, fad things, but do these simple little things to help yourself and your health.
Right. Tell us about the month of February and the importance it has.
So the month of February is the American Heart Association has declared it as Heart Health Month, and typically we, as we all hear and you read, you think about heart health as the leading cause, cardiac disease is the leading cause of death across the globe. Did you know that cardiac disease is the leading cause of death in females as well?
No.
So around about 1 in 5 females pass because of cardiac disease. So the American
And would that be the first heart attack they would have?
Usually 50% of people, the first heart attack is your only heart attack. So the first episode of chest pain is your only episode of chest pain. So with that in mind, with the knowledge that more people think heart disease is interlinked with the male population rather than the female population,
Absolutely.
the American Heart Association has made February Go Red Month to make women more educated in regards to their heart health and their cardiac health. So with that being said, we need to talk about the different types of symptoms that are experienced between males and females. Males, typically we get, if you have chest pain, you feel like a pressure on the chest. Some people term it, an elephant is sitting on my chest. The pain radiates at times down the arm up to the neck. They get cold sweats and so forth. It gets worse when you exert yourself, relieved with rest. The difference or the caveat here is that in females, they don't get those type of symptoms typically. So females and diabetics tend to be a little bit different. They tend to have a little less symptoms, so it tends to be more so atypical, as we like to call it. They tend to get pain in the stomach area or epigastric area.
Okay.
They tend to get a little bit of nausea, some slight shortness of breath. They can have some vomiting and some cold sweats, but not really the typical chest pressure.
It'll be less severe?
It'll be less severe, but it's actually...
But it's actually life-threatening.
It's actually life-threatening, and it's misconstrued. most people think, oh, this is, I ate something bad, and
Definitely.
this is my reflux or my GERD acting up, or peptic ulcer disease, when in fact it could be heart disease.
Right. So how do women recognize which symptoms they should be looking for, and how should they care for their heart health?
So, particularly if you're female and you're a diabetic, you need to be screened. You should be screened by a cardiologist. So
Okay. How often?
First and foremost, you should at least get one appointment, get evaluated, get baseline tests, baseline studies done, and an evaluation done, so that you're at least okay from that standpoint. And then later on, they can then arrange for a follow-up, be it at 6 months to a year down the line, if
Right.
everything looks okay. The other aspect is, if you're a female and you're having these type of symptoms, don't ignore it. Don't think that it's only reflux and
Or
so
it's just
forth.
a stomach
Or
ache
it's just
or
a
something.
stomach ache. Now, it's separate if you go out, you have food and come back, and other people around the house have similar symptoms. More than likely, that's probably just gastroenteritis or something of that nature. But if it's just you who's having it, and you're having it continually, and you notice these symptoms more so when you're exerting yourself, that should be of concern. That should highlight that, yes, I need to go get evaluated by a physician.
What about women in menopause?
Women in menopause. Excellent question, actually. So your reproductive hormones are actually cardiac protective. So as you get older, when the estrogen and progesterone levels go down, you have more and more chance of having heart disease. Your risk becomes similar to that of a male at that point. So females, when they're younger, they're a little more protected, but as they age, you have a higher risk. So that would be also key. When you get around that age, you should be evaluated as well from the cardiac perspective.
Right, okay. When we talk about Pakistan, and you've obviously been in the US all your life, and then you just came back over here, what would you say that you would see as a stark difference between maybe awareness or people being more invested in their health?
So I think one of the things is, at least abroad, there are government programs that are promoted, that are on television as well. Like, they have ads that show you and that guide you towards what you should be from that from the health standpoint, be it heart health, be it whatever health standpoint. Now, here in Pakistan, we lack that government programming. We've just recently started with it. If you look on boxes of cigarettes, they have those little pictures of gangrene or a gangrenous foot or something like that. So that's been in America for quite some time, those type of stuff. And then they've even stopped ads regarding smoking and so forth. So like Marlboro used to always have ads on. Those are no longer present. So in Pakistan, we're lacking the government initiative for it.
Right.
And if we have the government initiative, the backing to have these preventative programs, to talk about, heart health from a very the ages of adolescence. If you started in schools, you teach them like what you're supposed to do with physical activity, your diet. If it started from the grassroots level, I think that will expand in the future and help establish Pakistan from the health standpoint to raise it up to the standard in the West, which is what we're all hoping for and aiming for.
That's absolutely true, because it's a huge health burden.
It is, and like the more that we can aim on prevention, the less that we'll have those diseases convert into something that's an emergency situation, or, as you correctly said, a burden upon our society.
I also think that the media needs to step up. Can you imagine if we had on like our prime time, instead of all those politicians fighting with each other, we had health programs? What a difference that would make.
That would make a huge difference. I mean, if we have this, on a, if it's not even a daily basis, if it's an every other day basis, a weekly basis, if there's some discussion regarding health across the board, and it can be in different languages. You can do it in KPK, you can do it in Pashto here,
on the radio,
on the radio,
all
do
mediums,
it on all mediums, and then have like educational videos on YouTube for the newer generation who gets on YouTube and so forth, and have it backed by professionals. And let's go about it that way. That may help us in the longer run, rather than just, people looking online and trying to find it, because they're going to be swamped with this misinformation and not know what is right, what is wrong.
How often do you see young patients coming in?
So as we do see quite a bit of young patients coming in. Now, as an adult cardiologist, I tend to have like a cutoff of, I only see 16 years and above, but we're seeing a lot of patients come in their 20s with heart disease. In fact, I had a patient just about 2 months ago who was in his, I think he was mid-20s, and he had epigastric pain. And he thought it was just reflux and something, and it ended up being a heart attack. He had a significant family history of heart disease. So, I mean, people are catching it younger because of a couple of things. You have the Western diet here. Around every corner you see all the fast food. Fast food places, you see McDonald's, you see KFC. And so they're into that. The smoking is still heavily prevalent here in Pakistan as well. And the other key is obviously our inactivity. We're not as active as other people are. And we think, and then one of the major keys that I have not touched on yet is that our genetic predisposition to having heart disease. Southeast Asia has one of the highest levels of heart disease across the world.
Really?
Yes. So
why is that?
it's genetics. I mean, if you look at it, there's a Guyanese population that's now in South America. And there are transplants mainly from the subcontinent. So from India, the area. And they transplanted there, but they've looked at it, why their diet is different than the typical subcontinental diet. They've transplanted there, and their heart disease numbers are elevated. And it's because of genetics. We have a higher predisposition to having higher cholesterol levels than the rest of the population. However, you have to take that with a grain of salt. When you look at our other individuals up in the northern area, if you look at Hunza standpoint, most of those people live into their 80s, 90s, some into their hundreds. And why is that?
Again, the lifestyle.
The lifestyle.
Yeah.
They are going up and down the mountains.
Yeah.
They are eating organic food. And it's their exercise, it's their healthy lifestyle. And that has led to their longevity of life versus the rest of us who are stuck in, the rat race, so to speak.
Yeah, that is so true. And, like you very well pointed out, first of all, we have this huge challenge, you said, predisposed genetic issue. And then the sort of, the ostrich syndrome that, okay, never mind, we'll just keep on doing what we're doing and not worry about it. But it does catch up with you.
It does.
Sooner or later, if you do misuse and sort of, misuse your body and whatever you're putting into it and the way you are living, it is going to affect you. And, God forbid, you will have to see a specialist, a doctor, a cardiologist. And it's always at that time that a person thinks, oh, I wish I had changed this.
Yeah.
I wish I had done this.
Hindsight is always 20/20. Now, looking at it, it's better to start early. So if you ever have these concerns, I think there's no time better than today to go in and see your family physician or the specialist that you think may be the answer to the questions that you have, may have the answer to the questions that you have. So don't procrastinate. Get it done, because you never know. Your first episode of chest pain could be your last episode.
Yeah, that's very true. Very true. Also, the different procedures that we hear about, friends, families, you hear about a lot of people, oh, I had this issue and I went to the cardiologist, I had an angiography, or I had a stent put in, or, various different types of procedures. Can you just talk us through what they're for investigation and also for treating a patient with a blockage? Can you tell people who are, going to have that sort of procedure exactly what they're...
Yes, so when we feel, if you have certain tests, like if you have an exercise stress test or you have an echo that shows that there may be possibly a blockage somewhere, or you come in with symptoms that are classic for possible underlying blockage, the cardiologist may recommend an angiography.
Okay.
Now, there's another thing that is called a CT angiography that is done. That is a non-invasive test. So with that test, what they do is they put an IV in place, and they give you dye, contrast, that goes directly to the heart, and they take CT scan pictures of the arteries of the heart to see if there's any underlying blockage. That can only help diagnose if there's actually a blockage there or not.
Okay.
It's not for treatment.
Okay.
For treatment purposes, if your cardiologist recommends, they would say do an angiography. An angiography helps you with the definitive diagnosis. It is the gold standard of care for patients who come in. So if you're looking and you're concerned, they may say get an angiography. And what an angiography is we go in through, typically we try and go in through the wrist. So you go in through the wrist, you numb up that area, you put an IV in place, and then you pass catheters, which are long hollow tubes all the way up to the heart. And then we take pictures. You're laying flat on a table, and we inject contrast through those tubes, and we take pictures of the heart to see the contrast opacifies or fills up the vessel, and we see if there's any blockage anywhere. And if there's a blockage that is severe, and we deem a severe blockage by if it's greater than 70% narrowing of that vessel, then we have a discussion with the patient and the family in regards to the need for possibly angioplasty, which is potentially putting in a stent in that vessel if it's possible.
And that would be done at that time?
Yes, it can be done at that time. Typically it's done at that time.
Right.
I mean, it can be done later on, but ideally it should be done at that time.
Okay. So if someone has something that is more severe, that's when you go for the open heart surgery, for the bypass?
Yeah, so if it looks, we look at a person's risk factors. So if a person is a diabetic, if they have any valve issues, so if one of their valves is severely blocked or stenosed or severely leaky, and they also have an angiography that shows that they need a couple of stents here and there, those are the patients you typically send to bypass, because the valve, they can replace the valve during bypass surgery as well as bypass the blockages. Now, if it's a patient who comes in and they have just blockage in all three vessels of the heart, or at such critical locations where it's not recommended to balloon or stent that vessel, then we would recommend bypass surgery. So the typical recommendation is if you have all three vessels blocked, there's 70% or more, or you're a diabetic and you have two or more major vessels that are blocked, we typically say bypass would be the better option. But then again, that's a discussion that the patient will have with the surgeon, with the cardiologist as well, because we tend to work as a team. We like to do what we call the heart team approach.
Yeah, right. Excellent. What are the main fears that you come across with patients who are going in for major surgery?
So the typical fear is, you know, is it going to hurt? And we tell them, and is it going to hurt, and is it under general anesthesia? So when you do a angiography or an angioplasty, it's not under general anesthesia. You're awake for the procedure. You're given medicine to numb the area. You're given medicine to relax you, but you're awake for the procedure. The procedure takes about 10 to 15 minutes to do an angiography from the beginning till the end.
Right.
And then if there's something that needs to be stented, you typically add on about a half an hour, depending on the complexity of the blockage. And patients go home the following day.
Okay.
So you spend one night in the hospital if you have a stent, you go home the following day. Now, typical with the fears that you hear from patients is, oh, I had my relative or my friend had one done, and he still has the same issues. Maybe that relative or friend had other issues as well. So that's one of the major drawbacks that we hear from patients, that why it didn't help them, why is it going to help me? There are differences with everyone. Every patient is different. So there may be different things that that relative or friend may have had and that they may not have. So you have to look at it from that perspective. And then you always hear the fear here that, oh, I'm a diabetic. Why are you referring me for surgery? The thing is that diabetics do better with bypass surgery.
Really?
Long term, they are better. Because if you put in a stent in a diabetic, typically, the stent can clog up over time.
Okay.
So if it's one stent, it's fine, but if it's multiple stents and multiple arteries, longer term, they do much better with bypass.
Okay.
So that's why we tend to refer more diabetics towards bypass. But here in Pakistan, there's the misconception that, oh, I'm a diabetic, I shouldn't go for surgery because the wound is not going to heal.
Yeah, yeah.
So you have to look at the post-op care that a patient is going to get as well.
It's very important.
It's very important.
Yeah.
So it's not just that, and it's post-op. And they have to understand that you're going to have a month of post-op care that you're going to need, like a week in the hospital, and then the next 3 to 4 weeks at home that you're going to have to care for yourself. But longer term, it's going to be a benefit for you. So it's more so than just stenting in a diabetic patient.
Because psychologically, I think for a person to know that they're going to have major surgery, that must be a challenge for them as well. So do you get often therapists on board who can counsel them? And
so yes, we do have behavioral therapists that can counsel them. We have nutritionists who also counsel them regarding the nutrition. If they're diabetic, we involve the endocrinologist as well before the procedure and even after the procedures, so that we make sure that their blood sugars are optimized and controlled appropriately. And then one thing that we also have available is we have cardiac rehabilitation as well. So when a person goes for surgery and they come back, one of the main concerns that they have, and particularly family members have, are, can my father or brother go back to his normal routine? So with cardiac rehab, they do exercise that is being monitored by a physiotherapist. And they monitor them on the treadmill, make sure that they're doing things appropriately, and it gives the patient and the family a sense of understanding and calm that, oh, okay, I see my father or my brother or my mother exercising here, post-bypass, post-angioplasty, and they're doing well. So then they feel more comfortable going about their normal routine, daily routine at home as well.
And also, you know, after, it may be daunting for people, of course, understandable, but then you're actually going for a quality of life after that then.
Correct.
Which
Correct.
they, you know, well, I'm sure they must realize that later on, and you know, hopefully they have a good story to tell other people who are going to go for that procedure.
Correct, correct. So I always tell my patients, don't look at your quantity, look at your quality, look at your quality of life. So you should always aim to having a better quality of life. So if you can make little changes in your lifestyle that are going to help your quality long term, that would be the best thing. And particularly with these procedures, we're aiming not for the quantity, we're looking at your quality of life. So with the things that we do as physicians, that is our main goal, is to give the patient a better healthy life and a more quality of life, longer lasting from that standpoint.
How much is self-medication and, you know, hearing from, oh, you know, this blood pressure medicine didn't suit me. Really? I take this one. Why don't you try that one? I mean, blood pressure, I've seen this going on.
No,
and blood pressure medicines are not a joke.
No, they're not.
And
So I
well.
have, you see this pretty much every day. You have patients who come in and say, oh, I took this medicine, it didn't suit me. My family member, my friend was on this other medicine, so I decided to switch over to that. So what I would advise the general public is, please do not do that.
Don't do that.
Every medicine is prescribed for a certain reason. Some people, some antihypertensives or blood pressure medicines are better in diabetics than they are in other patients. Some are better in patients with chronic kidney disease than they are in others. Some, if a woman has high blood pressure and is pregnant, you cannot really take certain medications because of the harm that it can have to the fetus. So you should always consult a physician before you plan on changing or starting a medicine, and leave it to the physician to decide what is best.
Absolutely.
And the other thing that I see here often is that patients who come in with high blood pressure, they're prescribed the medicine, and then they take it and their blood pressure improves, and then they just discontinue the medicine on their own, which I try and explain that it's not like an antibiotic, that you're treating a pneumonia or you're treating an infection, and that antibiotic is only prescribed for 7 days or 10 days. This is lifelong treatment for that. So the way I like to counsel the patient is tell them that if you're a diabetic and you're here and I give you insulin and it brings your blood sugar down, does that mean you stop the insulin or the medicine that I've given you for your blood sugar control? They typically understand that, say no, because I need that for my diabetes. Same thing with blood pressure. No, you need this medicine. It has helped you control your blood pressure. You need it long term. It's not something that you can just stop after 2 weeks because your blood pressure is in check. Because the one thing people don't realize is blood pressure or hypertension is a silent killer. Because uncontrolled blood pressure can lead to strokes, heart failure, heart attack, chronic kidney disease, and dialysis. So, and by stroke, it typically leads to the type of stroke that is a bleed in the brain because of hypertension. So those can be catastrophic. So, and it doesn't show up until you have one of those signs that I just mentioned. You come in, you can't speak, you can't move one side, or you've had a heart attack, or you have heart failure. So that's why it's a silent killer, because you don't really realize it until the end.
Again, are we genetically predisposed towards high blood pressure?
It's our lifestyle. I think it's our lifestyle. Now, certain parts, yes, you can say genetics have a cause in it, but typically it's our lifestyle, and it's, you know, if you're a smoker, you have a higher risk of high blood pressure. The more caffeine you take in, the higher blood pressure you can have. If you're sleep deprived, if you have obstructive sleep apnea, anxiety leads to it too. Anxiety is a common cause of high blood pressure and can lead to heart disease if it's untreated or uncontrolled long term as well.
Right, okay. And are we seeing a rise in high blood pressure amongst younger people?
I think it's always been there. I think now we're just finally having people diagnose it and actually catch it for what it is.
Right.
Because we see a lot of young people who are on dialysis here. And one of the major causes of them going on dialysis is uncontrolled blood pressure. So I think it's now more people are educated regarding blood pressure. That's why we're seeing more diagnoses of blood pressure, hypertension in patients. And that's why I think, as we talked about previously, when you go back to it, we need to start educating people from a grassroots level. So starting in elementary school, in metric, FSE, starting educating them regarding, you know, your health, blood pressure, diabetes, these type of things. Because when they get out of that area, when they're out in the real world, they're going to be busy and they're not going to know. And then it's just waiting. And one of the main things you mentioned in the beginning is the sort of the fast food and the junk food, which is loaded with sodium. Correct. So most of the younger individuals these days tend to go towards fast food. That's a lot of their diet. That is a lot of their diet. So they need to be wary of that. That can lead to not only high blood pressure, can lead to diabetes, and can lead to high cholesterol as well, which are all your risk factors for heart disease. Right. Dr. Omar, thank you so much for sitting down with us today. And honestly, for me, it has been a really enlightening program. I've been able to understand, you know, so many things get sort of like twisted together, and it's been unraveling of so many things that makes sense to you. I think that's the main thing. What is the main message you want to give to our viewers before we sign off? It's been fabulous having you on the show. Thank you so much. And what's the main message you want to give our viewers? Well, thank you for this opportunity. I really appreciate it. The main message I'd like to give viewers is, if you have any concerns whatsoever, you know, you only have one heart. So please take care of it. And always look to the right person to get the treatment that you need. So if you have any concerns, don't just Google it, don't look online, don't speak to a family member or whatever. Go to your physician or go to your cardiologist to get the answers that you need, because you need to have a healthy heart to have a healthy lifestyle. Excellent advice. Thank you so much again. Thank you. And that's all for now. Until next week, stay happy, stay healthy. Bye-bye.